looks really bad. If a friend, a colleague, a loved one, or even a stranger was in such a situation, would you know how to help them to stop the bleeding or to prevent them from losing more blood? Well, worry not if you do not know what to do. We've got you covered. This is the First Aider Show, and I'm your host, Onyango Daisy Awor. Joining us for this show will be Dr. James Okeyo, who's an expert in this field, and he'll be telling us more about first aid, which we're focusing on today, and he'll tell us what are the causes of first aid. What do you need to do when you're in such a situation, and what can you do to prevent rebleeding or even prevent yourself from having a first aid? Dr. James,
yes,
welcome, and thank you very much for being here with us.
Thank you very much.
And I would like to ask you,
yes,
what are some of the causes of nose bleeding?
There are so many causes of nose bleeding. First of all, you can get a nose bleeding through trauma. Those people who have hypertension can also have nose bleeding.
Okay.
We have some condition called nasal polyps.
Nasal polyps.
Yeah, these polyps, you find them in the nostril.
Okay.
So you can have them. Sometimes they normally bleed. And also another thing, if those people who have high fever, high fever can also cause nose bleeding.
You talked of trauma.
Yeah.
How can trauma cause nose bleeding?
Trauma can cause a nose bleeding, you know, in our body, the anatomy. If you come here, I want just to show you something.
Okay.
This is our nose. So this is the muscle, but inside the nostril here, there are veins.
Okay.
So when you get a pressure or something has hit the nose, the veins can rupture,
okay,
and can cause nose bleeding. That's how nose bleeding can be caused through trauma.
And is the weather connected to nose bleeding?
Weather?
Yes.
The climate? Yes.
How?
It can be caused by, weather can cause nose bleeding because climate change, where you go to a place where there is different pressure, so the body try to balance the pressure inside and outside to be at equilibrium.
Okay.
So by that time, the vein can rupture, and then you cause nose bleeding. The high attitudes and the lower attitudes. Okay,
and also in reference to what you're telling us about the nose and if there's pressure and trauma, can stress also be a factor that causes nose bleeding?
No, stress is not really, unless you have hypertension, the pressure.
Okay.
Yes, but you know stress or depression can cause hypertension. So that one, we cannot rule it out. Sometimes it can cause.
And this nose bleeding, is it something that is very serious? Should we be really worried when we're nose bleeding, or?
It depends with the severity of the nose bleeding.
Okay.
But you know, when you are losing blood, it is something which is emergency. So it depends how long the nose bleeding will take.
Okay.
Yes. So it is serious. It is emergency.
Yeah, if you're joining us right now, we are actually talking about nose bleeding, and we've just discussed some of the causes such as trauma, there's high temperatures, and there's also the nose.
Hypertension, nasal polyps.
Yes, nasal polyps.
Yes.
That can cause nose bleeding. And I would like to ask you, what are some of the things that we can do when we find ourselves in a situation if we're nose bleeding? What action should we take?
Okay, the first action that you should take when somebody is nose bleeding, you know, as you want to help this person, you need to check your surrounding, the danger. So if there's no danger, maybe you know it is something has hit this person, it can also hit you. So you look for your surrounding first, and then if you are safe, you take this casualty to sit upright.
Sit upright?
Yes.
But he's bleeding. Why not lie on the floor, you know?
When you lie, you know, the blood, when you are bleeding, the blood will go back.
Okay.
But if it goes back in your stomach, blood, it is acid. It can, yes, it is an acid. It can cause something called gastritis.
Gastritis?
Yes, it can also block your airway because of the clotting. So you need to sit upright to control the aspiration.
And there's one thing that I usually notice with most people. I also had a friend just this weekend who was nose bleeding, and she was doing this, walking with her head tilt up. is that a right thing to do? Because, you know, you need to prevent blood from flowing down.
Losing blood, yeah.
Yes.
I know so many people, they fear losing bload.
Yes.
But that's not the right way of doing it.
Okay.
You need to sit upright, and then you raise your head up front, and then you pinch your soft nose. We call it the bridge of your nose.
Okay.
You just pinch it for more than around 10 to 20 minutes.
Okay.
Yes.
And when you've already pinched your nose, what else do you do? Because, you know, I also need to breathe if I'm the one who's nose bleeding.
That's
I need
a
to
very
breathe.
good
How
question.
am I breathing?
So you open your mouth.
Okay.
And then you can take a ice cube. You place on top of your mouth, or of your nose rather, or a cold cloth. You place it there.
Okay.
So when you place a cold ice cube, you know, the veins, they vasodilate and vasoconstrict.
When you talk of vasodilating and vasoconstricting,
yes,
expound it, you know, in a language I can understand more.
Yes,
What
vasodilation means that the veins are coming out to the surface when they get when it is hot.
Okay.
You know, when it is cold, they vasoconstrict. They go inside the tissues.
Okay.
So when they realize that there is cold outside, they vasoconstrict.
Okay.
So it reduces chances of bleeding.
So this ice or this cold towel that we are using on our nose, what is the importance of that?
The importance of towel,
Yes.
the cold towel, to prevent bleeding.
Okay.
Yes, it stops the bleeding.
Okay.
Yes. So when this person you have done like that, this person still bleeding, you can do pack. You pack the cotton inside the nostril. But if you have, do you know a liquid paraffin? Have you ever used it?
Is it the one we use to cook?
No, not that one.
Which one? Where do we get this
We
liquid
get them
paraffin?
in the pharmacy or the chemist or
Okay.
the hospital. So we need to have this. That's the reason why we have the first aid box.
Okay.
So you cannot miss a liquid paraffin in the first aid. Do you know this one? Have you ever seen it?
I have seen it, but I really don't know what is inside.
You've seen it where?
In cars, you know,
Very
when
good.
you're traveling.
So this is a first aid kit. We have even liquid paraffin inside. We have the spirit, but spirit you cannot use it when you are nose bleeding.
Okay.
Yes. And then we have the cotton tools. We have the bandage here. So this one we can use, you pack. You
put it
yeah, you
inside
put
the
it inside the nose.
Okay.
When you put a liquid paraffin, it will soothen. You know, this thing is rough.
Okay.
So you put it not to reduce the friction.
Okay.
And then you take this person to the hospital.
So viewer, if you're just joining us, we are talking about nose bleeding, and we've just gone through the steps that you can take when someone is nose bleeding or you're also nose bleeding. And we've said you can sit upright, lean forward a little bit, and pinch your nose for how long?
For 10 to 20 minutes.
For 10 to 20 minutes.
Yes.
And you can also take a wet towel or
Yes,
cloth.
cold.
A cold
Wet.
one.
Cold wet.
Cold wet towel.
Yes.
And put it on?
On forehead.
On the
your
forehead. Or if you have ice, you can also use that to put it on your forehead to help stop the bleeding.
Yes.
And we were just going over some of the things in our first aid kit, and we also said if you don't have a towel or you don't have ice, you can use liquid paraffin.
Yes.
And cotton wool, or what is this called?
It is the gauze.
The gauze.
Yeah.
Put some liquid paraffin on it, and then you can put it in your nostrils to help prevent the blood from flowing.
Yes.
And Daktari,
Yeah.
I just need to ask, what do we need specifically in our first aid kit for nose bleeding? What do we need in the house? Yes.
We need gloves. You know, this is blood. So we normally advise people to put on gloves.
But what if maybe my hands get sweaty when I wear gloves? And if I don't have any cuts or wounds on my hands, what's the purpose of gloves?
Gloves, you know, when you are going to touch the blood, and let's say I told you the causes of nose bleeding, maybe it's due to trauma.
Yeah.
You are going to touch the wound. You might infect that wound. So we need to put on gloves.
Okay.
But you know, this glove, there are so many people who are sweating and all that. So you are not going to stay with it for long. So
Okay.
there's no any effect whether you are sweating and all that. You just put on gloves. We need the gloves. We need the cotton wool.
Okay.
We need the liquid paraffin to do all these things.
So these things, they are in our first aid kits, and
Yes,
we can buy them when we
have
buy the
them.
first aid kit.
Yes.
And one more question.
Yes.
When is it that we should now raise alarm when we are nose bleeding? Now think this is serious.
No, what I said before, after doing this and you are still nose bleeding, or the person is still nose bleeding, go to the hospital. Yeah, you need, this is just a first aid you are doing just to prevent or to stop the bleeding. But if the bleeding still continue, take this patient to the hospital for further management.
And another question.
Yes.
When we are nose bleeding,
Yes.
does blood flow from both our nostrils, or if it flows from one nostril, what does it mean, or what does it signify?
It depends with the impact. Maybe if you have an injury, you can be bleeding through one nostril, or it can be both. So it depends. When maybe there is a fever, there are people who have blood disorder, the clotting time, the bleeding time. I think you remember your biology. Do you remember the clotting and bleeding time?
Yes.
Yes. Those are blood disorders. So if you have a blood disorder, you will bleed both nostrils. But due to trauma, it can be either 2 or 1.
Okay.
Yes.
And one more question. After we've done this process of sitting the person down, putting the cold towel on the forehead, what next to now not make sure that this person will have a recurring bleeding again? What do we need to do?
What we need to do for this person, if it is a trauma, it cannot reoccur.
Okay.
So what we need to do, we need to educate this person. Maybe if it is due to trauma, we can see the cause, so that we prevent further trauma. If it is a disease, I told you, if it is hypertension, take this person to the hospital to be treated for hypertension. If it is a blood disorder, if it is a nasal polyps, you take this to a specialist called ENT.
ENT.
Yeah.
What is ENT?
ENT means ear, nose, and throat specialist.
Okay.
Yes. So this person will be done something called cauterization.
What?
Cauterization. Cauterization means these polyps, you can burn them.
Burn?
Yes, you can just
in your
nose.
How?
That's the reason why I'm telling you it is cauterization. Through cauterization. Yes.
Okay.
Yeah, but I think that's not very important to the viewer. For the first aid, what we do, what you're supposed to do is you make sure you have stopped the blood.
Okay, and just one thing.
Yes.
This process, is it the same for both adults and kids, or for kids we handle them in a different way? Because kids are jumpy, sometimes they might get scared, and it will not be as easy to calm them down as an adult. How do you handle children?
It is the same. With nose bleeding, it is the same.
Okay.
Yeah, you need to sit upright. Adults normally sleep, even children are sleeping. So when you are doing this one, all of them should sit upright.
Okay.
And if you can remember, I told you the importance of sitting upright to prevent the blood not to go back from the stomach, or to swallow, or to bring blockage, because blood clot. It can clot through the airway, so that you can get difficulty in breathing.
And if I feel like sneezing or blowing my nose, or my nose is itchy, maybe during the nose bleeding, or just after the nose bleeding, am I recommended to blow my nose, or just sneeze, or scratch my nose?
Daisy, there are some things you cannot control, like laughing, like sneezing.
Yeah.
You cannot prevent, now I don't want to sneeze, now let me now sneeze. So sneezing, there's no problem with that. Yes, you can sneeze, or you can cough. Yes.
So it will not cause any further
It can,
bleeding.
because when you are sneezing, you exert pressure.
Yeah.
But let me say, when the veins ruptured and then you sneeze, you exert that pressure, and the opening keep on widening, so that the bleeding will be more.
Even blowing your nose and
yes, you
eating.
cannot blow your nose. If you
Okay.
blow, you exert pressure.
Okay.
That one, it is as if you are opening the veins to bleed more.
Viewer, we are going for a short break, and when we come right back, we are going to do a practical example of how to handle someone who's nose bleeding. And we'll also talk about ways of preventing ourselves from nose bleeding or getting into a situation that can lead us to nose bleed. So don't stay away. Stay with us and join us in the next few minutes. Welcome back, viewer. I'm your host, Onyango Daisy Award, and this is the First Aider Show. We were talking about nose bleeding, and we've talked about the common causes of nose bleeding, what actions you should take when someone is nose bleeding. And right now, we are going to do a practical example of what you should do when someone is nose bleeding. And joining me is a casualty who will use to demonstrate what action is supposed to be taken. And with us is also Dr. James Okeyo, who's the expert in this field and who's helping us. So I would like to urge you to also try this out as we try it out,
yes,
so that you can also learn it practically. When we involve you, you also remember whatever it is we are trying to learn. Yeah. And I give the floor back to you, Dr.
Yes, so we want to demonstrate. Let's assume he's now nose bleeding.
Okay.
So you run and look for the gloves. You take your gloves, you can take yours, and then you come. Do you know how to put on the gloves?
I have no idea.
No, because this is emergency, you just put it like this. Can you do it? Do it.
Wow.
Another
If
one.
I don't know how to do this, won't the patient bleed to death?
You tell the patient to hold, and then you sit upright. So, yes, like this. You sit upright, your head like this. No, yes, your head like this. And then you pinch. Can you pinch your nose and open your mouth?
Why can't we pinch it ourselves since we have gloves?
Before is now nose bleeding and you want to put on your...
Okay,
Yes.
so while we are putting on the gloves, he
Yes.
pinches his nose for
Yes.
himself. Okay.
And then after that, you come again here. You look for the cotton or the gauze. I told you this one. And then we have a razor blade here. We have a razor blade somewhere here. But you know these things, you need to know them very fast so that you open.
I'll help you do that.
Yes.
Okay.
So you cut this one. After cutting, you bring the liquid paraffin with you.
Okay.
And then if you have the ice cube, let me assume you have the ice cube, that's the one. So you tell this person to hold it. You do it like this. Open your mouth.
Why should we pinch it like that and not just hold it?
Pinching it, you are applying pressure to the veins.
Okay.
You apply pressure to the veins. And then you tell this person to open, to breathe with the mouth.
Okay.
So when sometimes let me assume this is ice cube, the cold one, you place it here.
And what about the wet cloth that we put on the
cloth,
forehead?
you place it at the forehead.
And this ice cube, do we put it while the patient is still bleeding or?
Yes.
Okay.
You put it when the patient is still bleeding.
And they are still breathing through their mouth?
Exactly.
Okay.
For around 10 to 20 minutes.
Okay.
So we'll be just doing like this. You add the patient.
You also push it as you remove?
Yes, as you remove it. As you remove it like this. And I think you can remember the reason why I told you not the patient, you leave the patient to lie. You know, there are some people, if their nose bleeding, they can
they
do it
tilt
like this.
the head
Yes,
backwards
tilt the head.
to prevent the blood from
now
flowing
you are
out.
going to swallow the blood.
Okay.
You cannot aspirate. The blood is going to block. It will be a clot.
Okay.
So when you swallow the blood, I told you the blood is acid.
Yes.
Yeah, you can get a disease called gastritis, or you can get peptic ulcer disease.
Yes.
Yes.
So if you're trying this out at home, we're talking about the basic steps of first aid, and we've learned that we should put our patient to sit upright. He should lean forward and tell him to pinch his nose while you wear your gloves for your own protection and to also avoid infecting the patient.
Yeah,
in
the
case
patient.
he
Even
or she has
yourself.
a wound.
Can I tell you something? When you touch the blood, we have diseases called hepatitis.
Okay.
Have you heard of hepatitis?
Yes, I've heard
yes,
of
hepatitis B. It is through the contact, if the fluid, the blood. So we need to put on the gloves.
Okay. And what if I don't have a
safety,
cut or a wound on my hand?
It doesn't matter.
Okay.
For you cannot know whether maybe the wound was healing. Now you don't feel any pain.
Okay.
So you cannot realize that you have any opening somewhere. So for prevention matters, you need to put on gloves.
Yes.
Yes.
And we've also learned that you should not tilt your head backwards like we usually do.
Yes.
You might swallow the blood, which is going to affect you in your stomach.
Yes.
And it can also block your airwaves.
Yes.
And we've also learned that you can put an ice cube on your nose or a
Yes.
wet cloth on your forehead here.
Yes.
So that it helps to prevent the blood from flowing.
Yes. And also, we talked about the liquid paraffin.
Yes.
When somebody is still bleeding, you pack. You can pack. You can take the liquid and then you pour it, and then you pack. And you advise this person, you pack it inside. Are you getting my point?
Yes.
And then you get another one, you pack it. If it is two, you pack it in, and then you encourage this person to breathe
Through the mouth.
And then you call ambulance, you can call the doctor, you take this patient to the hospital.
And how long should this process last before the bleeding stops?
It should take 10 to 20 minutes. Yes. If it doesn't stop, take this patient to the hospital because it is losing blood.
Okay.
Yes.
And just to remind us of what we had said earlier,
Yes.
after we've already done this first aid, how should our patient be so that we do not have a reoccurrence of the nose bleeding?
I told you there are causes of nose bleeding. First, it is through trauma. We can get it through trauma.
Yeah.
We educate these people. If they are children, you educate them so that they know that they do away or they move away from any object that can bring trauma to them. Those people who have hypertension, you take them to the hospital so that they get treated from high blood pressure. The blood disorder, I told you about the bleeding time, clotting time, those people who have different problems. You take them to the hospital so that they can get treatment, a proper treatment. Those people who have high fever, you stop the fever because fever can also bring nose bleeding. Change of climate, attitudes, where you go. It can also, when you come from low altitude and you go to upper altitude, higher altitude, the pressure in and out, it wants to come to equilibrium. So you have to nose bleed. So that one can also cause all those, the nose bleeding.
Does this nose bleeding come with any pain, or it's just the blood that is flowing but there's no pain?
With trauma, it has to come with pain because now you have right, there is a cut, there is a wound. But there are some times whereby there is just an opening. Yes.
If someone is experiencing pain from the trauma, how do you help them to reduce the pain when you're still also trying to prevent the blood from flowing and stop the blood flow?
You can give them painkiller, but that one is not necessarily you give. This one we are just doing emergency case. You stop the bleeding because when you leave this person, we lose blood. It can even get to shock, get anemia. It can be, So the main thing here is to stop the what? The bleeding.
Yes.
Yes. And then later, you take this person to the hospital.
And if someone has reoccurring nosebleeds, maybe it's something that happens frequently, how would they be able to treat it or even manage it when they're at home, if maybe going to the hospital takes a little while?
Okay, this person, there are some people, some of them even the nose bleeding can occur when they're sleeping. So when they wake up in the morning, they find when the beddings are wet with blood and all this. So all in all, what I'm saying, it's medical attention. That's the key point. Yeah. If you cannot live reoccurrence, if you have a occurrence, maybe you have a blood disorder. Yes. So the main thing after first aid, what we are doing at home is to stop bleeding. After bleeding, take this patient to the hospital.
And what can we do as maybe just people who are living and going about their businesses? What can we do to prevent ourselves from nose bleeding?
What we do to prevent ourselves from nose bleeding, because if you don't have all these conditions, you can get nose bleeding through trauma. So you be careful wherever you are. You be careful where you are going.
Not to hit yourself.
Not to hit yourself. You be careless. Maybe you are driving, walking. So just to take care of yourself.
And these nosebleeds that happen suddenly.
Yes.
What do they signify?
Suddenly.
Yes.
Sudden
maybe you're just seated and you just started nose bleeding.
Yes.
Probably you've never ever nose bled before in your life.
It is the same cause what we have already talked about.
Okay.
It might be maybe change of climate, change of weather, attitude. Maybe you are sick and you don't know. So they're the same causes. Be it sudden, but you know, nose bleeding, it is always sudden. It cannot come maybe.
It is not predetermined.
Slow. Yeah.
Okay. And viewer, as we have been talking about nose bleeding, we've just done a practical demonstration of what you should do when someone is nose bleeding. Sit them upright. Do not allow them to tilt their head backwards, because it will make the blood to flow back into their stomach and it might affect them. And it can also make them have cloggings on their airways and they will not breathe properly. So you should also have some ice cubes to put on the nose as you compress, and also they should pinch their nose in, how do you call this, the action?
The bridge.
How do you call the action of doing this?
You pinch.
You pinch, yes. Pinch it for about 10 minutes.
Yes.
And if the bleeding continues, you need to seek further medical attention because it might be something serious.
Yes.
Yes. And also, you should stay calm. Do not panic. I know it's a scary situation.
And
but
something before you finish, you know this anatomy of the nose. This nose, this is not a flesh. These are cartilage. Do you know a cartilage?
I have heard of cartilage, but you're not saying it's flesh, so I am now...
It is a cartilage.
Okay.
It is something, it is not flesh, it is not, it is a cartilage. So when you are pressing it, you press with a lot of care because you might even rupture the cartilage.
Okay.
Yes.
So be careful when you're pressing so that you do not injure the patient more and cause more damage, and be calm and allow the patient to also stay calm.
Yes.
And thank you very much for joining us for today's episode. We have more fun and exciting episodes lined up for you next time. So stay tuned and meet us here next week, same time.